Hi, my name is Sarah Dick. I'm one of the LVAD coordinators at URMC. I'm here to review the Driveline Management Kit with the chlorhexidine cleanser. First, make sure that you cleanse your sterile area and do good hand hygiene prior to this process. First, we're going to open the package. As a reminder, all the contents inside this package are sterile. There's a little slit on the back that we're going to go ahead and open along the seam. Carefully grab the package out. So inside this kit are directions of use. You can use this as a guide on the proper use of all the items of this kit. There are two masks, one for yourself and one for the patient. The first set of gloves are to remove the prior dressing. To apply them. Now, as you remove the old dressing, make sure that you're securing the exit site with your hand so you're not to traumatize it as you're pulling off the old dressing. Once all the tape is loose, make sure that you carefully remove the dressing and the split gauze and inspect your gauze for any drainage. Inspect your exit site for any drainage or soreness, and please notify the team if you see anything abnormal, any redness, soreness, drainage. You can then remove your first set of gloves and discard them. Now we get to our sterile supplies. Everything again inside this package is still sterile. This first thing you do, you see this little flap, you pull it straight out and down, and then you just open edge by edge, maintaining that your edges do not collapse in on each other, and open it up. Now there's another sterile set of gloves on the outside. Carefully with your fingers, remove this package without touching any of the other contents or items. Open your package without touching the inside of your gloves. Now remember, this is very important to maintain sterility with these gloves because you're going to be only touching the inside of the contents of the package, which contains the sterile items. So the second glove, I'm going to reach in the cup so to make sure that I maintain sterility of these gloves. Carefully put my hand in without touching anything else and put them on. Now, since I have my sterile gloves, I'm able to touch the contents of the package. As you can see, there's the ChloroPrep triple swabs in here. There's your 2x2 gauzes. There's what's considered an island dressing. There's an additional securement device. And there's your Centurion anchor inside of this. There's also some alcohol PEPs and some skin preps. First, I'm going to take my chlorhexidine swabs and carefully open them. There's 3 packages inside of these, so I'm going to take the first swab, start at my exit site, and I'm going to want to scrub here, right at the exit site, for 30 seconds. And then as you get the 30 seconds done on the inside, I'm going to go outward in circular motions and maintaining that I don't go back in and contaminate the area that I had just cleansed. And I'm going to continue going outward till I cleanse the driveline and all skin area that will be underneath my dressing. I will discard this first swab and I will repeat again with the second one. Now the package does contain a third swab, so if you notice there's any extra exudate or crusties on the Driveline, then you can use this third swab to get the additional material out. The important thing is just to not go from out to in, but if you got anything in from the exit site, to start with that first, and then grab any other material that you might need to get off for the patient. The next step will be applying the split gauze. You want to make sure that you come at close to the exit site, that you're not bringing material in from the external internal. So you want to come right next to the Driveline, carefully feed it through and pull it up to the exit site edge. Now this kit does come with an additional 2x2 gauze. If they have more than usual drainage, you can go ahead and put this on top. If their exit site is nice and clean, you do not have to put this on, because this island dressing does come with a gauze in the middle. Right now, we'll go ahead and put this piece of gauze on top. There is skin prep included in the kit, so if you'd like to apply skin prep to the area that will be covered by the island dressing, this would be the point you do it. Just carefully put it around the edges that would be coming in contact with that adhesive material. Next would be applying the island dressing. Carefully peel each edge. A line over the other 2x2s and firmly press down the edges. This is an additional securement device. Will go underneath and over the existing dressing. So again, carefully remove each tab. It will tuck under the Driveline and then overlap that island dressing. Make sure the edges are secured down and push down. So at this point, if needed, you could change the anchor. At this point, we just overlapped this additional piece over the anchor, but we're able to still properly secure the Driveline. Now you want to make sure when you re-secure it that your wings come all the way through and your arms are fully placed. If we needed to replace this, there is the anchor in the kit that does come with, again, the skin prep and the alcohol for proper placement.